What do you do while you're waiting to find out if you're pregnant after treatment? I'm Dr. Sharon Moyeri, owner and founder of OC Fertility. I'm going to share with you what you should be doing, what you should avoid doing, and an optimal day while you're waiting to find out if you conceived or not. So while you're waiting to find out if you're pregnant, what you should be doing is assume the positive, that you are pregnant. So you want to do the things that you would do if you were pregnant. You want to avoid alcohol, you want to limit caffeine, and you want to follow your doctor's instructions as though you were pregnant. So that's really important. So having a positive attitude is important, but more importantly, following the instructions is really important, assuming you're pregnant. The next thing is staying on all the medications. So if you're on hormone replacement, such as estrogen and progesterone, you want to stay on those medications. Your doctor probably has you on prenatal vitamins, including folic acid, possibly baby aspirin. You want to follow those instructions as well. There may be some other recommendations for supplements or treatments, and it's important that you follow those instructions carefully. One of the other things we recommend often while you're waiting is gentle movement, and this is something you obviously want to run by your physician and make sure that they're okay with the types of activities, but this is something that keeps your blood flow circulating as well. Finally, you want to be able to distract yourself and find enjoyable activities, and this will also help reduce stress for you. So find things and people that you enjoy spending time with. So if there's certain activities you enjoy doing for yourself, reading, watching movies, find time for those things. Self-care is really important during this time, and then spend time with the people that you love as well. On the flip side, you want to avoid things in that 2-week wait that you shouldn't be doing. So you don't want to stop your medications. You absolutely don't want to be doing anything that can be harmful, like drinking, alcohol, smoking, any kind of toxic chemicals that you wouldn't be doing if you were pregnant. That's very important. You don't want to do pregnancy tests at home, although I know a lot of our patients do. If you do a home pregnancy test, then please don't act on that test if it's negative, because they're not always accurate and reliable. So you want to wait till you have your pregnancy test with your doctor. You also don't want to overdo exercise. So if you're going to be active and exercising, please make sure that you screen it through your physician. Too much exercise may not be a good thing during this time. You're likely to have a lot of different symptoms, and these symptoms can kind of be confusing. You might have some cramping, you might have some spotting, you might have some nausea, and sometimes this can be really convincing that you're pregnant or that you're not pregnant if you don't have those symptoms. And truthfully, these symptoms don't really predict well whether you're pregnant or not. You might compare them with other people and go down the rabbit hole of Dr. Google or blogs, and the reality is everyone's different. The symptoms vary between pregnancies, even within the same person. One pregnancy may not be the same as another pregnancy, so definitely don't compare it to others, and don't read too much into every symptom or lack of symptom that you're having. So if you want to kind of break this down into, well, how do I spend my days? There's some things you can do that might help you get through each day. In the morning, make sure that you take care of yourself. When you wake up, have some herbal tea that's safe or some lemon water. Go for a walk, spend some time at home relaxing before you start your day. Midday, you might spend some time journaling or meditating. In the evening, you might want to take a warm bath. Just make sure it's not too hot. You might also want to do some light exercise, such as yoga, as long as that's okay with your doctor. Stretching is another option. And then at nighttime, you want to unplug. You don't want to be in bed looking at social media or at Dr. Google and going down the rabbit hole. So you just want to spend some time to unwind and really make sure you're getting enough sleep and taking care of yourself. Whether you're trying naturally with IUI or IVF, this time is very difficult. The 2-week wait can be challenging, and it's an up and down battle, but stay grounded and stick it out, and we hope to see you with a positive test very soon.